Good evening, everyone. I am Dr. Dawn Sherman, Vice President of Community Impact and Evaluation here at Community of Hope. I'm excited to welcome you all to our Conversation of Hope Birthing Justice virtual panel. I know it's only 2 days after Mother's Day, but I want to greet all the mothers, mothering figures, and birthing people to tonight's conversation. We honor you all. I am so excited to serve at Community of Hope. Community of Hope is working to make Washington, D.C. more equitable by ending family homelessness and improving health by directly addressing health inequities like the one we are discussing tonight. We serve nearly 18,000 people each year. Now that's an impact. As we begin a night of important conversation around Black maternal health, solutions, and how Community of Hope is answering the call, we're reminded of the issue at hand. Black birthing people in Washington, D.C. face alarming disparities in maternal health outcomes compared to other racial and ethnic groups. It is crucial to address these disparities to ensure the well-being of families in the city. According to that documentary, Black women in the United States are 3 to 4 times more likely to die during childbirth than white women. Just take a moment to think of the impact that has on our community. But we're here to talk about solutions and learn about how Community of Hope offers a robust approach to address these inequities. Birthing Justice captures the experiences and challenges of Black women, their families, caretakers, and advocates, and examines the structures and systems that determine disparate rates of mortality. Ultimately, this pivotal film celebrates the efforts to fix Americans' broken medical system and transform this narrative of tragedy into one of hope. And that's why they turned to Community of Hope to share this story. To prepare for tonight's panel, it's our hope that you've watched and digested the documentary and its many strong stories. We'll begin with the trailer to reorient us to the documentary, and then hear from today's moderator, Dr. Britney Gulledge.
Nice, strong heart rate.
A joyful, exciting, incredible experience.
Look at those lips.
And that's something that should be available to every family.
I lost my first baby listening to this doctor.
It's not something that we're doing that's any different from anyone else. Call it what it is, it's racism.
Things were kind of spiraling down.
Let's shift the narrative.
Our moms are worth it.
Now introducing our moderator, Dr. Britney Gulledge. Dr. Gulledge is the Director of Communication here at Community of Hope and a health communications researcher with Project Refocus, a partnership with Howard University, UCLA, and funded by the CDC. She has special interests in social justice, collaborative community health actions, and cultural impacts on health beliefs. Please welcome Dr. Britney Gulledge.
Everyone, good evening. I'm Dr. Britney Gulledge. Thank you so much to Dr. Dawn Sherman for the introduction. We just had a moment to watch the trailer, and in 30 seconds, it grabs you. I was just on the job just a few weeks with Community of Hope when the team started to film for Birthing Justice. And of course, I did my research about the organization when I joined, but it's something about seeing this work in action that really moved me. Although I came here with an interest in background in Black maternal health, it's different to see it through a new lens when you see these midwives in actions, the doulas, the program coordinators, and just hearing all of the ways that the team proactively looks to remove barriers and build connections with their patients and clients and their support system. So this topic is really near and dear to my heart. And frankly, it's time that we start discussing solutions for Black birthing people, babies, and their families, because they are also deserving. So with that, let's go ahead and introduce tonight's panelist. We have Dr. Ebony Marcelle, Director of Midwifery, who has been with Community of Hope for 11 years, celebrating next week, anniversary. We have Well, we have Abayea Pelt, Senior Director of Maternal and Child Services, with 7 years of great service here at Community of Hope. And we also have Heather Wise-Reed, mom of 4, 3 of whom were born at the birth center, patient of 8 years, and recent board member with Community of Hope. Thank you so much for joining us tonight for this great conversation, and I cannot wait to hear more of your individual insights and expertise. So let's start with a question for everyone to get the panel going. The Birthing Justice documentary is really bringing forth conversations around the important topics of Black maternal care to a national audience. I would love to hear each of you kind of share why you think this is important. Yeah, perfect.
Should I go first? All right, I'm gonna go. I think that it's bringing needed attention. We still are running into folks who are not aware that we have a problem. We still feel like, we feel the privilege of the US with having a better economy, but we spend way too much money on healthcare, and for our maternity care systems to still be as challenged and broken and producing the outcomes that they do. So we definitely need to still continue to create awareness, to create policy change, to create systems change everything.
Yeah. And I'll just add, I think, we focus on equity. We focus on the fact that Black women, women of color have not had an equal experience in this country. And that relates to how they birth as well. And honestly, Black women, women of color, we deserve the best. It should be beyond just equity that we're talking about. But the fact is that when we improve the experiences of people with the worst outcomes, it improves things for everyone. So we're talking about, white women in rural communities that have, challenges with access to healthcare. So, it can start with us because we're focusing on those of us who have the poorest outcomes, but it really expands, to everyone's access and everyone's outcomes.
Again, I would definitely agree with both of you. I think Black women need a voice even when they're quiet. When we walk into facilities, we should walk in knowing that we are going to get the best care and quality care based on the need of each individual. And I think that is, like you guys said, is something that needs to come to the forefront and need to be heard. And we need to do something about it.
I'm getting excited just hearing you guys bring all of this together. Let's jump right into something we heard in the film. Dr. Ebony Marcelle, what are the factors that impede Black women and birthing people's access to quality medical care in Washington, D.C.?
So I think a big piece of the challenge is just really looking at DC divided into the haves and the have-nots. We still have a lot of differences when you look at Ward 1 and 2 versus when you come down to 7 and 8. And then, we're still going to have the conversation about the fact that we still don't have a hospital that offers obstetrical services at the bottom part of the diamond past the river. So, we're asking families to travel, and we're talking about under-resourced communities. We're asking them to travel sometimes hours to get uptown to have their baby. That's not appropriate. Other things like we don't have the opportunity for high-risk pregnancies to get all of their services taken care of east of the river currently. Things like barriers on places with, policies against them bringing their other children to visits. We're still dealing with a lot of inequities in the access of care. There are places, but they're not really up to par. I'll say that.
Awesome, thank you. And so, Abayea, I know the work that you do with Community of Hope really seeks to address a lot of this. So Community of Hope has a team that provides not only clinical, but also really addresses these social determinants, many of which Dr. Marcelle was speaking on. So what are the highlights of the comprehensive set of services that the maternal and child health team provides, and why are they so important?
Yeah. Thank you so much for this question. It usually takes me about 45 minutes to walk through this entire flower because we have so many services that wrap around that crucial clinical care that Ebony and her team provide. But we know that our patients need more than just, the medical care, the excellent medical care that we provide, that they often are challenged with finding food resources, that they need help getting baby items, and that they just need support in different ways. And so some highlights from this flower, we have a team of perinatal care coordinators that come alongside our patients. They engage with them right at the first prenatal appointment. And they continue working with the patient until they're at least 6 months postpartum, but can be up till the youngest child in their family is 18 months old. And what they do is really work to reduce barriers to care, support with transportation, support with scheduling medical appointments, reminders about medical appointments. And, in the postpartum period, ensuring that they're connected to things like emotional wellness, if that becomes something that they need. We also have a team of doulas that work with our midwives so that our patients can get that support that they need during labor and delivery. We do have our own in-house transportation services as well. We have an important partnership with MedStar that brings maternal fetal medicine so we can provide more of those services for high-risk pregnancies that Ebony mentioned. We have home visiting services, and I think I'll also have to mention our WIC program that we launched just last year so that we can provide really important nutrition support to our patients, nutrition education, and not just for our patients. This is for the community at large as well as lactation support, breastfeeding support, and nutrition support for the child until they're up to 5 years old. So those are some highlights to how we, kind of do even more than our clinical care.
I really do love the model itself. And I think at some point I've even heard the perinatal coordinator considered pregnancy concierge, like someone who was there throughout every single step. So I actually really loved when I heard that. I would love to hear from you, Heather, as someone who has experienced so many of the awesome services here. What has been your experience giving birth, and how did it compare to your expectations or what you've heard from others?
Well, I'll start with the expectation because I did have a hospital birth prior to the 3 birth center births. I just wanted to have a voice and wanted people to listen because I am advocating for myself, and be there, support me, and educate me for the things I did not know. And the experience it superseded my expectations. The birth was peaceful. They listened. It was definitely joyful. I had funny moments. And my family was there. I think the midwife supported more than my family, and they even coached throughout the birth, coached my husband with things. It was a really good birth, the actual birth. And then postpartum, someone got to come visit me at my home and also educated me, walk with me. And even to this day, and she's 3 months, I've had someone reach out, set up appointments when I forget, because you get busy with a newborn. So I think having that access was wonderful. And those are things that I did not have with my firstborn. Oh, and then I'm sorry, one more thing. Compared to what brought me here was someone was saying, I think you'll be a really good fit because of my experience at a hospital. It was very traumatizing. When I was telling them, as far as like my body is not ready to push, they were kind of forcing me to push. And I think letting my body do a lot of the work and listening to me was the biggest thing with all 3 births in a birth. And I definitely thank the midwives for that.
Thank you for sharing, honestly. I can only imagine these are the kind of stories we hear so often, and then were reiterated within the film that we all watched. So thank you for sharing. So Dr. Marcelle, we've made so many strides in the right direction. We're hearing all of the awesome things that Community of Hope provides, and we're on the brink of seeing some change happen. From your perspective, what priorities need to be laid out for us to continue to address these disparities?
I think the first priority should be innovation. I know I say that a lot all the time, but I'm serious. Like, I feel like we need to stop just trying to do what we've always kind of done and really, really try new things that really, really essentially are more patient-centered and, like, you know, centering the most marginalized. Really, really taking a look at our policies, you know, wherever you are working in the system, you know, making sure that you aren't preventing someone from having a better experience with their care. So I would say definitely making sure that we are looking at policies, making sure that we are also creating more awareness around an acknowledgement of racism and its effects. You know, I wanted to kind of add in the previous my previous comment was that we are trying to tackle a problem that is generations long. It's not something new. And it's not just going to be fixed with one thing. Just like that flower shows, everybody should be providing that much of a wraparound and support in all facets of healthcare. So, you know, trying to make sure that, like, it's more holistic, it's more around what the family needs.
Thank you. I also do want to open up. I want to make sure, I know I'm calling on one person at a time, but if there's any point that you want to jump in, please feel free to jump in, panelists, and add to. I do
Great,
not
'cause I
want to
was
hold up our
scared.
conversation. Huh?
I said great because I was scared.
Oh no, please do. We are able to do that. And so the film really does speak about listening to Black women, listening to birthing people. And I know that, Heather, you also just spoke about not feeling like your voice was heard in some other experiences that you had, unfortunately. So Abayea, I'm curious, what does this really mean for you and the work that you do? How do you elevate the voices of the birthing people that you assist or share their concerns?
Yeah. Ebony in her last answer talked about marginalized identities. And I think when we're talking about Black women, Black birthing people, we have to recognize that, you know, intersectionality means that they are carrying the identity of being a Black person in this country and also a woman or, you know, a femme presenting person. And we know that, you know, our society does not recognize, you know, the needs of Black women, does not value, you know, their stories, does not value their voice. And so I think it's really important when patients come to Community of Hope that do identify as Black women, that we recognize that they're bringing into that appointment so much more than we can realize. They're bringing in, you know, their experiences, what happened to them that morning, what happened to them in their childhood, and, you know, what were the experiences of other women and birthing people in their family, and how has that passed down as well? You know, thinking about generationally what Black women have experienced in this country around birth and sexuality. And so that means that we have to really take time, slow down, and truly listen for what's not said as well as what is said, value those voices, reflect back what people are saying, and never make any sort of plan or care plan or goal plan or anything without the input and understanding of the patient. You know, we are just players in their care, but this is their body.
I love that, letting them be in the driver's seat. No one knows your body better than you. I love that. Dr. Marcelle, did you want to add too? Heather, did you want to add anything to that? I'm going to start opening some space. I do want to hear your voices.
I absolutely was on mute talking about to everything that she was saying, to everything that she was saying. You know, I think that's really, really huge because we're not trained that way in medicine as care providers, that people are the experts of their own body, and they are. They absolutely are. But not only their own body, their circumstances, their situation, they know way better than we do. And, you know, it's time for us to also, you know, look at how we're caring for folks with that in mind.
I just want to ditto what you two said. And then I also, when I share my birth stories with just people who are pregnant or expecting, I brag on Community of Hope. I always say, I love them because you're not a number, you're a person. A lot of times when you go to the hospitals, you're like room number 2 or like room 4, but they know who you are, they listen to your needs. And I think knowing that you're not a number and you are a person is like one of the biggest things that I love about Community of Hope.
Thank you. So actually, Heather, I'm going to stay right with you on that. As you're talking about sharing your story and letting other people know, I'm curious, like, what do pregnant people need to know about advocating for themselves from your perspective?
I think one, knowing just on the political side, knowing who your Congress people are, knowing what Congress members are in office so you can push things, push agendas. I would start there. Also using your platform. Some people use social media, so use social media. And when you do go into a lot of these different birthing experiences, write down what you want, talk to them prior to your birth, ask questions, because a lot of times it's not that you don't know what you want. Sometimes you don't even know where to begin. So definitely ask questions so you can say, that's not what I want, that is something I would like. And then share your prior experiences, because I think that's what helped me. I was like, I know I don't want this, and I do want this. I did enjoy this. And then things that sometimes, like with my last daughter, although I had 3 kids, I was more traumatized this time than I was last time because I knew what I was going into. And then this, again, this big maternal health, I was just like, I just want to be alive after I deliver. So acknowledging that that's an activated fear. That way your birthing coach or your birthing person knows like you're okay. They can keep you posted, and also your family, because I kept telling my husband, this is getting scary. I just want to be alive. And I think he was just like, you're okay, just breathe. Is everything, like asking me more questions. And just like the midwives also, they were like, you're okay, this is how much you dilated. So they were informing me, making me feel a little bit more comfortable.
And I think that's so important. This kind of even goes back to what Abayea was speaking on earlier, really making sure that we're understanding what people are coming in with, right? So you're not only carrying the weight of nervousness from your previous experience, but also you're taking in all of these statistics and you're learning. So you're becoming more aware, and you're also carrying sometimes the anxiety that can come with, I am a Black birthing person. I'm coming to this experience and I know what the statistics are. Like, how do I make sure that I am not a statistic? So thank you so much for sharing that. That takes a lot of incredible vulnerability. Dr. Marcelle, so for you, what do you think the people who are joining us virtually today, particularly those with power and privilege and influence, for those who are wondering what they can do, would you like to share what you think they could do from your perspective?
So I could have had the whole webinar, you know, to discuss these things, but definitely want to reiterate what Heather was talking about. People forget the power they have with voting. Make sure you're putting people in office that are going to be doing the right things. So really rehoning and pay attention to that, paying attention to, you know, laws that are potentially going in. Shout out to Momnibus, making sure that you're reaching out to whoever your, you know, congressional person is to make sure that they're pushing Momnibus through. That is a beautiful packet of bills that are going to be super, super important in helping to change this Black maternal health landscape. Other things, money, you know, if you have money, make sure that you're donating, support Black-led, Black-supported organizations, support community organizations. It really, really just is like a pinch in my nerve when I, hear people reference other spaces that have never been involved with the community. Look at the different outreach options, volunteer. There's so much work to be done, not only from the outside and what you can project, but even like on the inside. Everybody's at home for the holidays and hearing the relative make very, racist, homophobic commentary. It's time to have that conversation with them. So the work can be just as like internal as well as broadly out, to a lot of other realms.
Yeah. I remember not too long ago, after the documentary came out, I was having lunch with a couple, and I just casually mentioned the disparity for Black birthing people, and they were like, "What disparity?" And I'm just like, we're living and breathing it every day, and there are people who have absolutely no idea of any of this. So raising awareness in our circles, following people on social media, promoting people who are talking about it on social media can be really powerful. But there's just a lack of awareness that we need to kind of figure out how to cross that, that gap.
Thank you so much. And I want to make sure that we leave enough time to answer as many questions as possible from our attendees. So our last question that I have for everyone here is, there's so much data around Black maternal health being heavily focused on this deficit, but how do we approach this topic with solutions? Like, how do we keep the narrative of joy at the center? So what does Black joy look like in birthing to each of you?
I can start off. I feel like a joy, like education. So and making sure your patient is educated about what they can do, because a lot of times we're restricted, or we're honestly just uneducated about a lot of things, and because we don't have the privy to those things that some of our counterparts have. And I also think listening to what I'm telling you about myself. So if I'm advocating for myself, listen to me, don't shut me down. And I would say making sure the experience is worthwhile. We're already in a little bit of painful state, so ensuring that the needs of the patient is met.
I think, shining the light on real stories, real people, people like you, Heather, when you joined our prep call with your little one, it's like, that's what it's all about, and I have the privilege of doing an infant massage class on Saturdays at FHBC from time to time. And I get to see people and they're like, "Oh, I gave birth here," and this is the baby, that's the joy, and it really ties in like all of these things, because I'm usually behind a spreadsheet, I'm behind a database, I'm, meeting with my team, and I don't get to see patients as much, but that kind of keeps me connected to those stories. And, like you're saying, like the data can be heavy, or we're trying to, get funding for a program, the stories and the listening and, remembering and bringing those patient voices in as much as possible, like we're doing right now, that can really help and bring that joyful component as well.
For me, birthing Black joy is, this profession is a calling. I just found out my great-grandmother was also a midwife, and I didn't know that. So I have that legacy. But I also love the fact that I get to channel that, I always say granny midwives in the community. And I'll give you some great examples. Like the other day, I was absolutely in line at McDonald's, judge somebody else, not me. And I was in the drive-through, And there was a young lady who was absolutely giving somebody the business on the phone. She was upset, but like she stopped mid-conversation and she said, wait a minute, that's my midwife. And like, I stopped arguing and like was like, hey, how you doing? Just like in the community. And like that just completely warmed my heart. And then I had this fall, I had two what I consider grandbaby catches. Like I caught the mom and now I'm catching the daughter, and just having that like space and time. And like, I've caught people's cousins. I've been in births where, there was 3 people in the room, but 3 different family members, I've caught their baby. And that to me just brings so much joy to have that kind of continuity and connection with this community.
I'm sorry, I just want to chime in with Ebony, because the day I went into labor, it was morning and she was not on call. And I found her on social media and I was like, I'm having my baby today and I need you to be there. And she was saying she had family come in from out of town. And I was like, I need you to be there. And then when I got to the birthing center, she was there. And I think, like you said, like those moments are where it's just like, I called her up, like she was like a cousin, like, hey, I'm having the baby. I need you there. So everything goes right. You know what I need you there. And she was there. And then the last story was my daughters, the 2 older ones, they're 6 and 4. We were in the birthing center and they was like, Mommy, that's us on the picture. We're famous. Because they saw a picture of them and they were telling everybody in the family, like they're famous, they have their picture up. And then so many people sends me that picture, like, oh, I saw your picture in the birthing center. So I love that. And of course, my famous babies love it.
They are famous. They are.
I really do love hearing this so much. All of the synergies and how grateful and how exciting is it that you can call up your provider, right? And request them and knowing that they will be able to answer. Those are the kind of beautiful connections that I see at Community of Hope all the time. So I'm just really grateful to even be able to witness here. So now for the fun part, we're going to actually take some questions from our attendees, and they are racking up. So I'm going to start fast before we get behind. Let's start with this question from Nicole Bruno. Nicole, question is, what can a patient ask a care provider to get a sense if their care is personalized and anti-racist / biased? The documentary discussed how anti-racism training still isn't taught in many medical programs. So what are red flags, or at least yellow flags, and what might be some green flags? Let's take a piece of that. And I would love to hear from whoever would like to take that.
I love to talk about implicit bias trainings, just because I'm not really a big fan. Because I'm sorry, guys, like 1 hour is not going to make somebody less racist. And I also feel like we've kind of been crutched by this, so that now it's become, again, more of an individual problem, and it's a systems problem. It's a lot bigger than that. So, yes, I think you want to work with and engage with folks that see, anti-racism, anti-Black, education, support being a continuous thing, not something that maybe somebody has to do one time, but it's constant. And then make sure that also those efforts are, looking at whatever policies that institution has or that organization has. To be truly committed starts from the top all the way down. So to me, those are green flags where I see folks that are like, this is continuous. This isn't one thing everybody just does one time. This has the involvement of not only the direct care persons, but the admin folks, the CEO, everybody. So continuous and like everybody and like just all the time.
I agree. I think knowing that these trainings are not just to check a box, because sometimes we do these trainings and it's just, 100% of our employees took the anti-racism training. So like Ebony said, no, we're not racist. Or making sure you dive in. So again, these are everyday listening to phone calls, going in, seeing how, making sure your patient feels comfortable. But my number one thing is ensuring that it is not just a check on the box to say we completed this and this is already done, because that's just the start of the training. The training is actually hands-on, and it shows what you do when your patient is in there, what questions are you asking? And like you said, some things, like I know sometimes I had a friend who, she has 4 kids, and she said when she went into a thing, they was like, "You're pregnant again?" Like that. I was just like, wait, what? And she was like, they was like, well, how many kids you plan on having? Like those things, because that immediately shifts like someone's, oh, I don't want to be here. Like that really makes you feel uncomfortable. So making sure that it doesn't stop with the training, is you're diving in, and it happens every day when you walk into your office or when you're interacting with the patient, even outside of work. So ensuring that these things are not just a check on a box.
I just wanted to add really quickly, thank you, Heather, for also acknowledging that not all trainings are equal and alike. Not everyone explains what you just completely gave the great example of microaggressions, so that's the other challenge, that they're not all equal. But I wanted to also put out there, as I'm in this, work right now, I am working with organizations in spaces that makes the employees want to be anti-racist, to want to make sure that they're not being anti-Black. And like that to me is really important. Be that type of organization where your team, your staff wants to do better and want to make sure that they're, taking care of folks the appropriate way.
Thank you. So we have another question from India Hunter for Ebony and Abayea. As many of us know, the stats for maternal mortality has gotten worse since the pandemic. In the same time, awareness and funding have increased greatly in the MCH space. What do you all think is needed to see that funding and awareness make the impactful change? Yeah, okay. What do you all think is needed to see that funding and awareness make the impactful change? Okay, I had to make sure I read that right. Would we like to answer this?
I mean, I can speak from a programs standpoint, and I don't want to get too in the weeds, but I will just mention that all of the most of the programs that were in that flower are, funded through a patchwork of, grants from local government, federal grants, private donors. So there's this increase in awareness, there's this increase in funding, which is great. But if we're really going to make change, it needs to be systemic, and not just a special interest of a funder, or, it's something that, the local government is focusing on right now. That might change, that might shift, but when are we going to see, as Ebony said earlier, everyone needs to have these. So not just the organization that got the grant, but like everyone needs this kind of support. And so to do that, we need to see Medicaid, supporting and paying and reimbursing for things like comprehensive care coordination, home visiting services, and, all of these things that we provide through this patchwork. So I think that we would see a greater impact in these kind of services and a further reach of these kind of services with that kind of consistent funding.
I think for me, my challenge with it is definitely there's more funding, but let's also acknowledge that not all funding is going to maybe the places, it should go. Funders have definitely prioritized larger institutions that aren't even like touching the community, so making sure that funders are being more mindful, but not only that, whatever funding needs to be unrestricted. My God, do we have to always give Jesus tears, whenever we get grants? They want the most outrageous, sometimes the most outrageous, reports. And that is so laborious and takes so much energy from the folks trying to do the work. So also thinking about funding that is more unrestricted, like just give the money. And yes, like still also working at a system that like insurance are paying for these things, right? We still need insurance companies to like, they're a whole conversation right there. Just the inconsistencies with insurances and what they're reimbursing. So, definitely there's been an increase, but I'm not ready to come or say or I don't really feel like all the funding has always been directed to the places that it really, really needs. And people are working real hard, real hard.
Thank you. Okay, we have another question. This one is from Mercedes Millen. Says, hey, beautiful
Mom.
people. It's so great to see all of you, and I'm so glad this conversation is happening. Would there be a Community of Hope FHBC in the east of the river? Abayea, would you like to take this one?
Yeah, sure. So I do want to make sure everyone knows that we have definitely a presence east of the river at our Conway Health and Resource Center location, 4 Atlantic Street, Southwest, right off of South Capitol Street. And so at that location, our midwives are there, they're present. It's not a birthing center, but if people are patients, of course, and receiving care at Conway, they can birth at the birth center that is in Northeast or at Washington Hospital Center. But we are committed to bringing the care that you see at FHBC to Conway. Some things got a little disrupted during the pandemic, and we're looking to really bring those services that we had at Conway back. So yeah, I think, you can get excellent care from our midwifery team as well as our other providers at that location.
And I'll just add, like, sure, it would be great to be like, hey, we're going to have another birth center. First, I would like to use the one we have. We have this very big, gorgeous, beautiful birth center that is not used nowhere near as much as it should be. So I would love, for any, no knocking anybody else who wants to build, but I'm just saying, like, we need to use ours more. We can use ours way more than we do.
So we have another one from India. It says, also, I think a lot of the conversation centers around mortality for moms, birthing people and babies. But I feel like we rarely hear about morbidity, even though it's also a huge issue. Does Community of Hope have any specific programs for mothers who develop disabilities and other conditions post-birth? Ebony, would you like to take this one?
Sure, it's clinical. So I just want to make sure maybe I'm answering you right. So please jump in the box. I think we actually do. Like, the benefit of us being a federally qualified health center, the fact that we have full family care, the fact that we are engaging in innovation that continues engagement the first year of postpartum, I feel like we definitely are. Now, for folks that are really, really super sick, who really have a higher acuity, we're not there yet. But for the majority, with maybe some, a baseline bump in acuity or things that need to be followed afterwards, there's nothing more lovely that, like, we've had a baby together. She had preeclampsia. I co-managed her with the docs at hospital center and made her postpartum plan. She comes back to me at the birth center. And then I'm like, hey, after, 6-8 weeks, here's your next appointment with primary care to continue to manage your hypertension. I'm not saying go get an appointment across town. I'm not saying I don't know how it's gonna happen. I'm able to put an appointment in her hand before she leaves. And to me, yes, that's really, really key.
Thank you. Heather, we have one for you. India said, what Heather said is so true. With more awareness, how do we make sure moms are not driven by fear, but are informed?
I love the censoring piece that Community Hope offers, where it's a group of moms. I think I met Mercedes there, a group of birthing moms who are due around the same time. So if you're due, you'll probably meet with maybe I know it was maybe 9 women that was due around the same time when I did centering, where it's support from other moms. You guys are going through the same things. You guys are advocating, bouncing ideas off of each other. You're asking providers questions. And I think that's to have someone support who's literally going through the same thing is critical with centering, because I met a lot of my mom friends through centering, because again, you guys are going through the same thing. She finds out something, she's like, we're texting, we're following each other on social media now. Our kids are friends. And I delivered my second daughter at the same time as one of the centering moms. She got there before me, but I beat her to the punch. But I think centering is something that a lot of people could adopt, because it just puts you in a closed space, but you have a big voice.
Love that. Thank you. Okay, that's one of my favorite programs. And for Ebony, we have another comment. In what ways can people help support Community of Hope, specifically for DC residents? Are there any specific things that we can ask our council members to help support with the healthcare inequity for Black mothers in the district? Also, thank you for your work.
Thanks.
Oh, wait, and they're saying that their level of care was exceptional. This is Crystal Gorham.
Oh, hey, how you doing? I was at that birth. Yep. I actually think I'm gonna leave this for Kelly. Kelly's gonna finish us up. She's our dynamic CEO. I think that this would be a better question for Kelly.
Okay, and then we have one more. What would help pregnant and expecting moms, birthing people, families give birth at Community of Hope, FHBC currently?
You mean to use the birth center more? That's
Yeah.
what you're asking?
Mm-hmm.
Right. So, I think we are trying our darndest to make sure that everybody has an opportunity to have great labor preparation and childbirth education. Even with centering, our centering is still not all of our patients are able to come to centering. So trying to get a more concentrated, formalized way to give folks preparation for birth, I think will be really helpful, because what we find is a lot of people are interested in it because they saw somebody do it on Instagram or because they're scared. And unfortunately, that is not enough to help you tolerate contractions. So what happens is folks have some contractions and they're like, yeah, I'll meet you at the hospital instead of at the birth center. So I think more preparation, I think more, great stories and celebration, because we are a word of mouth community, and hearing from other people who have successfully delivered at the birth center is also very, very encouraging, because family influence is real strong as well. We do have a lot of folks who are like, well, my mom doesn't want me to, or my partner doesn't want to do it. So really, really also, sharing your story, when you're out and about, because you never know how impactful it could be for that person. And then, of course, I think we're going to start really, really working on our social media presence. Make sure you tag us on some good stuff if you've been a mom with us.
We actually have time for one more question. How do COH mothers pay for these services?
So we're about, I think I'll just say for our 2 locations, where the midwives predominantly see prenatal patients, predominantly Medicaid. We accept all forms of insurance. We also have self-pay. We definitely try to work it out. And to be fair, out of the 400 plus birth centers in this country, we are one of probably 15 that accepts Medicaid. So we are already just trying to be a great example of how to make sure we're continuing to provide access to under-resourced families. And I think I also saw on the bottom of the question, home birth. Yes, it would be my dream for everybody, even if they were under-resourced, if they wanted to have a home birth, they can have a home birth. But we still have a while to go for that.
Yeah, and I'll just add that we are a federally qualified health center, and so we provide healthcare to people regardless of their ability to pay. And so if they don't have insurance, we do have sliding scale. We have enrollment specialists that can help people to get insurance if they don't have it. So we will work with patients where they are. And then in terms of all of our wraparound services, the home visiting, the care coordination, that's all free of charge. There's no out-of-pocket costs for any of that.
Okay, awesome. We do have a little bit more time. So I would love to hear a little bit more about our innovations in our postpartum care. I would love to hear from, everyone here, specifically Dr. Marcelle and Abayea.
And Heather can add because Heather received some. So this is, the concept was really trying to expand and keep folks engaged the first year after you have a baby. Like most of our standard traditional treatment is, we see you maybe once between 6 to 8 weeks, and that is just not enough. And midwifery model care has always included early postpartum care, but like depending on where that midwife is practicing, facing the challenges of like getting reimbursed for that and those efforts. So really, really having a broader look at what would it be like to have folks engage that first year, to really, really broaden the concept that everything just stops at 8. To quote my friend Chanel Portia Allen up in New York, postpartum is forever, really. So, I mean, we're still not really doing it justice, even with just that full year. And so we thought about introducing the opportunity for home-based care for the newborn visit, for the early postpartum care, and then the postpartum care later on in the weeks between 5 to 8. And then trying to offer like some peer-led groups and support through that can, folks can kind of jump into through the various stages of that year, engaging with them to come back in at like 6 months. Some people, I know I was trained, you see somebody, you're like, great, you had your 6-week checkup, we'll see you in a year. No, like, hey, come back within 6 months. And then I should have seen you multiple times before we get to a year. But really, really trying to change this, this thought process that we just kind of help folks for barely 6 weeks after they have a baby and then shoo them on their way. And we've got to change that, because we know that almost 50% of maternal mortality deaths occur after the birth. Postpartum is a very neglected part of the childbearing experience that we have got to start putting some more efforts towards.
And, in addition to those innovations that we're partnering with the midwifery team on, I just want to add that we have other interventions. Our home visiting service begins during pregnancy. This is our non-clinical home visiting services that's focused on maternal care as well as child development. But that continues until the youngest child in the family turns 3 years old. So, beyond even the first year postpartum, going into maybe second baby, third baby, they can have a family case manager that provides home visits and support. And then we have different groups. We have parent cafes, we have infant massage groups, which are parenting groups. People get together, learn infant massage, but also just get to meet with other parents and get that kind of support that's so important. And then all of that ensures that they stay connected to us, so that if they need connection to emotional wellness, we have an emotional wellness specialist that specifically works with our maternal patients, our perinatal patients. So we have a very innovative and integrated model here at Community of Hope.
I definitely just want to chime in really quick to agree with Ebony. I do think it should be a little longer and not even just talking about what we're talking about today, but even with postpartum depression, a lot of times the newborn sleeps a lot. I don't know, mine does, but then around about 3 to 6 months, things start to change. And those who have other kids, things could start to shift, your body starts to change, and you could still be in a lot of pain from the birth. So I do think that postpartum period should be extended. That is an American thing to think that you can go back to work at 6 to 8 weeks. I don't know, like that is crazy. But I do feel like the birthing center are doing really good things like breastfeeding groups, the home visits, the phone calls. So they do have a family engagement specialist that reached out. They actually did everything for my birth certificate. So all I had to do was go pay and pick it up. And this was all done over the phone. So they do assist a lot, but it's still so much more that could be offered in that postpartum period, and starting with extending this period from 6 to 8 weeks to a little bit longer.
Well, this time it actually does wrap up the time that we have. So thank you so much to our panelists and all of the amazing knowledge and that you shared with us all. I'm going to go ahead and turn it over to Kelly.
Great. Well, I am Kelly Sweeney McShane. It is my great honor to be CEO of Community of Hope. And I have to say, every time I listen to Ebony, Abayea, and Heather and Britney talk, I learn something more. You make me laugh, you inspire me. So thank you so much for all you do. And thank you so much for everyone who's here with us. So I am gonna take Crystal's question, which I appreciate. I'm so proud of the work that Community of Hope does, but we really cannot do this alone. We do it with based on a lot of support from a lot of different people. So there's a couple of ways that we would invite you to get involved. First, we encourage you to spread the word. Please share the link about this documentary. As we were saying, not everybody knows about the crisis. And this documentary is on until June 9th. So please encourage people to watch it and learn more. If you know someone who's pregnant, who's interested in receiving our services, we're going to put the phone number in the chat so you can call and encourage them to become a patient. And please follow us on social media and share inspiring stories. And thanks to those who are patients who shared today as part of their questions. And then secondly, we would encourage you to share and contribute to Community of Hope. And I echo Ebony that unrestricted funding is a wonderful gift, because your gift, whether it's through credit card, checks, or cash, really allow us to support these programs, to do new innovations, to put our funds and our resources to where the need is most, and that need does definitely change. We do also accept gently used baby items. We have a parent's baby closet at Family Health and Birth Center. And so things like clothes and equipment, and again, gently used, please. We do accept those, and there is a link in the chat, and you can email our team to schedule a drop-off. So in closing, thank you again so much for spending your Tuesday evening with us. I hope you are as inspired as I am and committed as we all are to really improving health outcomes and bringing joy back to birth. Thank you very much, everybody.